Hello everybody, my name's Sophie Scott. I'm going to be the host for this fantastic webinar. So we're just going to wait for, we've got about 130 people have jumped on already. So we're just going to wait for a few more to join before we get underway. This is the second NeuRAtalks webinar for 2022. And I'm really delighted that I'm going to be part of this important event to talk about mental health, wellbeing and resilience. Before we get underway, I do want to acknowledge the traditional owners on the land on which I'm coming to you from, which is the Gadigal people of the Camaragal Nation, and I pay my respects to elders past, present and emerging. And I also want to acknowledge any Indigenous guests who might be joining us online, watching now or watching later. And this webinar is going to be very similar. If you've watched any of the other NeuRAtalks webinars, this one will be run pretty much the same way. I'll be doing a discussion with the expert panel members, and then it'll be a chance for you in the audience to ask some questions as well. So don't need to wait till the end of the session to ask those questions. You can pop questions in the Q&A box at any point throughout this panel discussion, and then I will answer them in the last 15 minutes of this session. But I just will give a brief reminder that we're not, our experts are not able to answer any specific questions about someone's treatment or prognosis or give any specific medical advice. I also wanted to just urge you, if you're on social media, which a lot of people are these days, it would be great if you could follow NeuRA on Instagram. So their Instagram handle is NeuRA Australia, which is all one word. And if you're on Instagram, and I post a lot of mental health content on Instagram as well, if you're interested in connecting with me, mine is Sophie Scott and the number 2. So it's great if you want to post on Instagram. We can share some of the learnings from today with a broader audience as well. So I might now switch over and we might introduce our panel. And we're really delighted to have such a fantastic group of experts joining us to talk about this important topic. So I'll introduce our panel one by one. We have Professor Richard Bryant, AC, is the Scientia Professor of Psychology at the University of New South Wales and the Director of the Traumatic Stress Clinic at UNSW and the Westmead Institute for Medical Research. And Richard's had a distinguished career, starting off as a psychologist working with people with burns and trauma. And he's studied and has become a world leader in trauma and mental health, and particularly acute stress disorder, which is now recognised as the world expert on this topic, as well as being an expert on traumatic stress and complicated grief disorder. He also has a particular interest and expertise in developing interventions to help low and middle income countries, and he works with the World Health Organization on this. So we're delighted to have Richard with us today. Give him a virtual round of applause. Thank you, Richard, for being here. We also have Associate Professor Justine Gatt, who leads the Wellbeing and Resilience Group at NeuRA and the School of Psychology at the University of New South Wales. She did her PhD in psychology at the University of Sydney and then took up a postdoctoral research position at the Westmead Millennium Institute, looking at the genetic markers of risk for mental health, particularly depression and anxiety. And Justine's led some really important projects that we're going to hear about today, including the Twin E study into emotional wellbeing, which looks at the genetics and environments and brain markers of risks for mental health and wellbeing. And Justine's also looked at neuroscience and the genetics of resilience in adults and adolescents and ways to promote optimal wellbeing using digital health and other intervention strategies. And more recently, she's expanded her scope of work to look at healthcare workers and children, which is so important. So thank you so much, Justine, for being here. We really appreciate you being with us. And last but not least, we have Kate Connors, who is the Chief Mental Health Officer at PwC. And she's also here representing the Corporate Mental Health Alliance of Australia. Kate also trained as a psychologist and after gaining a master's in counselling, focused on the corporate work environment. And at PwC, she leads the strategic development and internal programs to drive wellbeing for 10,000 employees around the country, such as the program which is called Green Light to Talk program. And she also provides confidential wellness support to 800 PwC partners. And the Corporate Health Alliance, Mental Health Alliance is not only just professional services, but it's also retail, banking, insurance, technology. And as part of that alliance, Kate collaborates in a share and learn model on key projects that the alliance is implementing, including important issues like increasing leadership capability on mental health. So welcome, Kate, and thank you also for your time today. We really appreciate it. So I'm going to start with Richard. And don't forget, in the audience, we're happy if you want to pop any questions in the chat box, and I'll aim to get to them at the end, once I've done interviews with all three. But Richard, let's start with you. And I'd really like you to briefly explain to the audience, how do you define the boundaries between what is stress versus what is seen as trauma? What's the key difference?
Sure, it's a good question, Sophie. I don't think we really need to explain stress. I think we all know what stress is, and anybody that's lived through the last 2 years, we definitely know what it is with COVID and lockdowns, etc. It's basically when we're just under a lot of pressure, and I think we all know experientially and physiologically sort of what it can do to you. Let me focus more on trauma and how that's qualitatively different from stress. And essentially, it's a few things. It's number one, it is precipitated by a really life-threatening event. So it is something that threatens our very well-being or the well-being of somebody we love. And typically it's something like a war, a disaster, an assault, humanitarian crisis, something like that. We know that most of us in the community will be confronted by an experience like that at some point in our lives. And we know that about 4 or 5% of Australians actually have PTSD, for example, at any one time. It's different because in the process of PTSD and the trauma, we actually have to sort of resort to our basic survival instinct. And so the brain has to react very, very quickly to react to something. So let's say you're bushwalking, you come across a brown snake, it suddenly goes for you. Now we instinctively will, jump and run away or freeze or something like that to take action. Our brain is very rapidly processing that in a way so that all the stress hormones go into sort of hyperdrive. It allows our fight and flight response to kick in. And that's totally adaptive. And for most of us, when all that's over, we calm down and we can walk away from that experience and we can go bushwalking again and all the rest of it. But for a proportion of people, ballpark about 10%, they actually don't get over it again. And it's like the brain stays in a hyper alert, hyper vigilant state. And so it learns that everything that was associated with that first experience is actually going to signal or trigger a threat response. So every time I go bushwalking and I see a twig or a stick or I see a hose in the backyard, I'm going to think of the possible snake, and that brain takes me back to the experience. I think the threat's there, and then I'm going to have a lot of the reactions, which is I'm going to have intense fear, intrusive memories, and fear of my well-being.
And so what's actually changing in the brain when that happens? What's the mechanism of what's going on when someone's in that situation?
It's very much, we know from a lot of work that's been done that there are certain parts of the brain, which is, if you like, the center of emotional response. It's a very tiny part of the brain called the amygdala. We know that tends to be hyperreactive, and that's where we sort of make these associations of what goes on at a trauma and with other sort of fear and the things that are happening at the time. But there's other parts of the brain more up the front here. They sort of down-regulate those fear responses, and they allow us to sort of learn that, no, it's safe again now, and we can move forward. In PTSD, it appears that frontal part of the brain that regulates the other parts, that's not operating properly. We're not able to recruit it properly. And this means that people aren't able to sort of enjoy the learning experience that the threat is now over. And we've got a number of studies now, quite a few, that tell us that that's actually quite impoverished in people with PTSD. So there seems to be a rewiring of the brain. And again, it tends to be happening in about 10% of people.
Interesting. Is there any knowledge or data to explain or even predict which of us who might go on to develop anxiety or PTSD or complicated grief disorder? Are there any predictors or things that you can identify in someone that might be a predictor of whether you're likely to go on to be in that 10% that you mentioned?
We've learned a lot about what predicts risk for PTSD. What distinguishes whether you go down anxiety, PTSD, or another route, we know a lot less. To be perfectly honest, what we know a lot about is what's a risk for a psychological disorder. The risk for different types we're not very good at. We know that genetics always takes up a good third of explanatory value of who's at risk. We know a lot more about whether somebody can go through a PTSD route or a complicated grief route. And by complicated grief, I mean the person has the normal grief reaction that we all know or most of us know what it is, but they just don't get over it. And for most of it, the intense pain of grief tends to subside after about a year. It's not to say that I've got over the loss, but the pain is starting to ease. For about 7 to 10% of bereaved people, that doesn't happen. And the grief is just ongoing. We know those people, even if they've also been through a very traumatic event, and we've seen a lot of that in COVID, to be honest, that tends to happen more in people who just have a very close, reliant relationship with the deceased. So if I'm just, my whole world is that person, and then that person dies, and I really don't have independent ways of coping, then those people are highly at risk of developing complicated grief. So what are the interventions that you developed, Richard, to help assist people in these different situations, like with PTSD or with the traumatic stress or complicated grief disorder? Well, I'm not going to sit here with the hubris of saying I developed them. It's been sort of the evolution of 30 or 40 years from a lot of teams around the world. But we have very good treatments now for both, for PTSD and grief. Let me say at the outset, if we're totally honest with ourselves, 60%, at very best, 70% of people actually respond to these treatments. We have a long way to go to actually get a better success rate than that. But in essence, what we're doing across those different disorders is we are teaching people to process the memory of the very difficult experiences they've been through, either a trauma or a bereavement. We do this repeatedly in a very safe environment in therapy. That can be tough, but we know that it's highly successful in helping people actually get better. It's very different from just counselling. The other major component is that after going through or having PTSD or grief, people tend to have very habitually negative thought patterns. And so we need to teach people to sort of alter how they're thinking. So it's becoming more evidence-based. And all of this sort of comes under the umbrella of cognitive behaviour therapy, which people will be very familiar with probably as a term. Oh, thanks. Thank you, Richard. We better move on to our next panelist, but thank you. I'm sure there'll be some questions at the end. So Justine, let's move on to you and talk about well-being. How does well-being relate to mental health? Like, what's the correlation between the two?
Yes, so I guess when we talk about mental health, it's composed of two things. So we've got the mental illness symptoms that we often think about when we think about mental health, but there's also mental well-being. And well-being is defined as that state that actually encompasses our levels of happiness or satisfaction, and it actually underpins, how we can live a meaningful life, but also our resilience to stress. So when you consider the actual mental health continuum in the general population, we know about 20% of the population, so that's about 1 in 5 people, have some sort of mental illness. And it's often assumed that if you don't have mental illness, that you are therefore doing well and you're quite healthy. But actually, if we look at the levels of well-being in these people, there's a lot of variability. So you will find that about 10 to 15% are defined as languishing, So that's the sense of having apathy or emptiness or just a lack of interest in everyday things. Then on the other end of the spectrum, there's about 15 to 20% who actually define as flourishing. So they're doing actually really well. But the majority of the population, which is about 50%, actually defined as moderately well. So even in the absence of clinical symptoms of illness, there are a lot of people who are actually quite struggling at the moment or any time. And so it's important to consider both well-being and illness symptoms when we think about our mental health.
And we might just go straight into talk about some of your interventions or your programs that you've developed based on your research, because the key aim of your work is to sort of develop those intervention strategies. Can you tell us about the Thrive program, which was offered to healthcare workers through COVID? What was that program and how was it received by the healthcare workers?
Yes, so Thrive is a wellbeing program we co-designed with the nursing education unit at the Prince of Wales Hospital for healthcare workers, and it was actually something we designed pre-COVID. We just pretty much wanted to just promote their well-being, but when we rolled it out, it happened to be during COVID, so it was pretty good timing. But the goal of the program was to actually educate the staff on how different health behaviours can impact their well-being and their brain. And we also provided tips and strategies to boost their well-being. So it covered 7 key topics. So it was sleep, diet, exercise, stress, life purpose, the importance of social connection and relationships, and cognitive challenges.
And so what sort of impact did it have? I would imagine it would have been so well received to have something like this, particularly at such a challenging time for healthcare workers.
Yes, so we rolled it out twice last year, and we actually looked at, so it was tied into a research study. So we actually collected measures to see, how effective the program was. And we found really promising results. So those who actually participated in the program showed significant improvements in both their well-being and distress levels. And it was particularly prominent in those who showed lower resiliency from the beginning. And we even got a lot of unsolicited feedback from the staff who found the program really enjoyable. So we're actually going to roll out the program across the whole Southeast Sydney Health District to all the healthcare workers in the next few months.
And so so with the sort of interventions, just so the audience can get a bit of an idea, what were the sort of interventions that you were encouraging the people in the program to do, just so that the audience can get a bit of an understanding of what they did to get those improvements in their well-being?
So, for example, it was very much psychoeducational based. So each webinar, it was a 60-minute webinar for 7 weeks, and each one would cover the topic. So, for example, we would talk about sleep, the prevalence of sleep problems, how poor sleep will actually impact the brain, but also later on in life. And then we worked in some strategies that are really easy strategies that anyone could actually implement. So, knowing the things to do to, if you're having sleeping problems, knowing the things to do to avoid if you're having trouble falling asleep. Also, in terms of, for example, stress, we incorporated a few brief techniques like mindfulness and controlled breathing. These are all things that we probably have heard of before, but we were just trying to package it in a way that everyone could actually just implement it quite easily into their everyday life.
Oh, that's great. It's fantastic that it had such a big impact. And now you're preparing to launch the first Wellbeing Resilience app that's actually based on really solid neuroscience. Can you tell the audience about that?
Yes, this is another project that we're really excited about. We've been building this wellbeing app for the last few years together with the tech company Maroma Project Factory. And the app is actually called ReNeuWell. So the reason we called it that name, ReNeuWell, is to bring together the elements of resilience, neuroscience, and wellbeing. And it's actually designed for the average healthy adult looking for ways to understand and boost their own wellbeing. So it's not actually tailored for individuals with mental illness. It's more for everyone else who might not necessarily be diagnosed with a mental health problem, but they want something or some way to actually just boost their well-being. So the app, we're actually going to launch it to the general public in the next few months. We'll be circulating a website where you can register interest if you want to be able to download the app when it's available. But I guess the really nice quality about this particular app is it provides users with their own wellbeing score profile. So it's using a wellbeing scale that we actually developed, and there's a whole lot of neuroscience evidence behind it. And then it creates a personalized program of activities that they can do based on their scores each day. And so I guess what differentiates the app from a lot of apps that are currently available is it actually provides a comprehensive measurement of wellbeing, and it uses one of the only wellbeing scales that actually has established neuroscience behind it. So we're really excited about it.
That sounds amazing. It sounds so good. And as Justine mentioned, we'll be sending out an email after this event that has all the links and the links for the website for the app and any other websites or things that we mentioned today. So if in the audience, if you're interested in chasing that up and registering for that. And just before we move on, Justine, just briefly, can you tell us about the work that you're doing with children between the kids 5 to 12?
Yes, so I guess the whole reason why I do this kind of research, which has mostly been focusing on adults so far, is to actually apply it to kids and adolescents, because adolescence is the key period of onset for many mental health problems. So what we have been doing is we've created a new wellbeing scale for children that the child can actually complete rather than relying on the parents and teachers. And then it measures both key components of wellbeing. So that's both hedonia and eudaimonia. And so we're trialing out this scale at the moment in children from 5 to 12 years of age. The scale is actually called Compass Kids, and we're trialing in the general public. So once we actually validate the scale, we can use it then to create programs and to understand neuroscience again and wellbeing resilience in kids. So I'd really like to reach out to any families or teachers who are interested in actually helping us recruit kids on this project to again go to our website that will circulate and register your interest, because we really need some kids to join that project.
Excellent. Oh, thank you for that. Now we might just move on to Kate. So thank you, Justine. So we're to talk about mental health in the workplace, and we've heard you've previously stated that our work or employment should add to our mental health, but I wanted to ask you, how often is that actually the case, that work is good for our mental health?
Yes, it's a really interesting question. And just before I kick off, I just wanted to say how great it is, and thank you to NeuRA for the opportunity to talk about the workplace's role in this conversation, because it's a very, very complex one. And it's been great to hear about the individual factors that drive mental health and wellbeing. And also a hello to all the employers and CMHIAs out there. So I think it's really important that we're talking about individual factors as well as workplace factors, because it does, as I said, it's a very complex picture for employers to navigate when they're beginning to think, how can we maximise, the well-being of our workforce? And to your specific question about how often is it that, mental health is enhanced in a person's employment situation, to be honest with you, we really don't know. And that's part of the thing that the CMHIA is really keen to lean into. But when you listen to Justine and say that, 50% of the population is moderately well, I would say that we do think that there's probably a really important role for workplaces to play in boosting that number in terms of where the population data sits. And I think one of the key things that the CMHIA is keen for a conversation about is to really educate employers' role in that, and to agitate and to encourage employers to think about how can they measure those things differently or begin to measure them, because really at the moment not many employers do measure well-being of their workforce. The closest thing that I think that corporates are more commonly measuring is engagement. And there is a lot of research that talks about the connection between an engagement level in their workforce and wellbeing. So that's probably a bit of a proxy measure that employers are leveraging at the moment. But at CMHIA, we would love for that to be that employers are leaning into very specifically and trying to work out a way to measure the wellbeing of their workforce. And for anybody who is interested to know more about this concept of work being good for us and such a fundamental component of wellbeing, the health benefits of good work, which is an initiative by the Australasian Faculty of Occupational and Environmental Medicine, and it's a collaboration as well with the Royal Australasian College of Physicians. So there's a lot of really good information in there about that idea that, you know, work is actually really designed to be good for us.
Good for you, yeah. Do we know what the factors are which determine which are more likely to make an employee flourish or languish? Do we know what those workplace factors are? And are there any of those factors that are sort of more important if you sort of had to line them up?
Yeah. So it's again, I love hearing people talk about this in the context of the mental health continuum. I think that's really important in terms of one of the key workplace factors, which is about us destigmatising conversations about mental health and wellbeing in the workplace, and the mental health continuum is a great way to do that. I think in terms of looking at workplace factors, a key model or a key framework that's spoken about a lot is the Thrive at Work framework that Curtin University and the Professor Sharon Parker and the people at the Future of Work Institute have developed. Now that framework has got three key pillars. It speaks to preventing illness, mitigating illness, and preventing harm and mitigating illness. And so each of those three pillars has also got other building blocks. And so that actually, I think, speaks to one of the key complexities of mental health and resilience in the workplace, is that we really need to be thinking about it from an integration perspective. And as we know, in most employers, there's a function that talks about leadership skills, and there's an area that talks about workplace health and safety, and there's another area that talks about career development, and there's another area that supports people if they have come into harm or they've hurt themselves. And so there are so many different factors that the Thrive at Work framework looks at all of the evidence and has really distilled that down for us to give us some pretty clear direction as to what an employer should be looking at in terms of areas of focus. For me, if I was to pick kind of key areas for focus as a little tips, I think that the cultural area is really important. So creating a culture where people can feel free and can feel safe to raise issues about their mental health and wellbeing is really critical. Another key area is to do with leadership capability. So how well are we supporting our leaders to have really good capability in themselves in understanding mental health in the workplace, as well as how to support their teams. And then the final key workplace factor, if I was to have to just to pull out three favourites, it would probably be around the team and role design kind of concepts, and how to make those work as effectively as possible, thinking through the modern world of work in terms of flexible work practices as well as hybrid work practices. So that's probably where I would put my three as suggestions.
And so, Kate, you mentioned leadership. How do you work with leaders so that they can model sort of wellbeing management themselves, but also be vulnerable enough to so employees can feel comfortable to come to them if they are having issues, if they are having mental health concerns, that if they feel that they can have those sort of frank conversations with their bosses? Yeah,
look, I think, and Richard mentioned it in terms of really this area of leadership, I think, has taken a really momentous leap forward, because all leaders out there have universally experienced the challenges of the last few years. So one of the key components, I think, is for leaders to learn the value and the importance of mental health and wellbeing in a workplace and stepping into that. So I think that COVID and the challenges of the complexity of the last couple of years has been a really big tick. I would also say, though, that there is research out there and data that suggests that our leaders are the people that have been under the most pressure over this period as well, because they're not only trying to support their teams, but they're also managing themselves and the complexity of trying to go into the strategy of running the business in the way that we've had to, and what does that mean for service delivery and all of those other complexities. So I think our leadership population has learned the value a lot more in the last couple of years. So that's probably step one. I think another component of it is their own literacy. So recognising for themselves where their wellbeing is at. And so that's a really important component of it as well. So how can an employer create the opportunity for a leader to check in on themselves, to build their own literacy and capability in understanding where they're at, because that's going to be leading into my third point. It's about role modelling. And so if a leader doesn't really recognise where their own wellbeing is at, and maybe they're not role modelling good practice or building on the individual kind of practices that Justine spoke to, then that creates, a real challenge for their team, because
if you're seeing your boss sort of sending you emails at 6 in the morning and expecting a response, it's difficult to say to that boss, I'm only going to check my emails, on my work hours. So definitely. So before we move on to the audience questions, Kate, I might just briefly get you just to talk about the Corporate Mental Health Alliance, just for those in the audience who are not across it. What are some of a key project that you might like to tell us about that the Alliance is looking at?
Well, one of the key ones that we're looking at is to do with that earlier point around data and research. So a really important one is that we're developing what will become hopefully an annual survey, where we're going to be gathering information on key relevant data points to do with psychosocial risks in the workplace, to do with what kinds of strategies are working amongst the membership group. And we're going to share that information so we can better benchmark against each other, and really build, I think, the literacy of the corporate community in understanding what works to support our workforces.
Oh, thank you for that. Now we might just go to audience questions, and there's actually one, Kate, we might just stay with you because there's one that just sort of just follows up on that point that you were mentioning about, and they're asking, how do you, when it comes to mental health wellbeing, it's about employee privacy. How do you get a good understanding of the wellbeing of your staff while still maintaining confidentiality? How do you sort of make sure you're not invading people's privacy but still wanting to sort of check in and see how your staff is going?
Yeah, look, that's always one that's a real challenge. I think that takes me back to my point around the culture as well, in terms of creating a culture that this is things that we talk about, and we're here to support you. I think another component of it is, again, in terms of the building the capability of people to understand confidentiality of private health information, and to build a trust within your workforce that we have policies that really put that into practice and put that into place to, again, build that sense of safety that people will talk about things. And I think that then goes back to that other point around, if people begin to hear that employers aren't sticking to their practices around that, then it's going to be really difficult for people to feel comfortable to share those things. So it's really important that structures, policies, and frameworks are put in place to protect people's privacy, so that things don't get talked about, but that whatever needs to be adjusted or supported is put in place, and to protect and to help that person's mental health and resilience recovery.
Okay, thank you. Now, just for the audience, just feel free to pop any questions in the Q&A box, and then I'll be able to ask our panel. We've got a question about how do you help a family member who's got depression? So, Justine, did you want to answer that one? What would be your advice for someone who, if you had a family member with depression, or who was sort of, you talked about that sliding scale, if they were more on the side of having a depression, what would be some ways you could support that family member?
Well, first of all, you would want to support them to seek treatment. So I would suggest you encourage them to go see a GP as a first step, and they would usually recommend that you go see either a psychologist to get behavioral therapy, or sometimes you might need to see a psychiatrist to get medication, depending on how severe the person is. And I guess, and maybe Richard can add to this, but the thing with depression is it's, you know, it's quite a difficult illness to deal with. So, it's comprised of a very quite saddened kind of mood state, a loss of interest in a lot of things that someone would usually enjoy. So it's helpful to, I guess, encourage them to find things that they really enjoy doing and remind them of what those things are, as well as provide the emotional support that they may need, because usually with depression, it's very easily, the tendency is to withdraw. So you don't want to talk to people, you just want to be on your own. And so you kind of need to really be there, I guess, to always support them so that they don't go into that really quite deepened withdrawal state.
And Richard, I might just see if you have anything you'd like to add to that for the audience. If they have a family member who is suffering from depression, what's the best way that they can support that family member?
I think probably number one, don't feel it's your responsibility to make the person feel better, because it's a great task to take that on yourself. Depending on how long the depression's gone on, it can be difficult to treat, but it also can be quite simple to treat, and it does need to be tailored. One point I'd give is that people want to go to the Black Dog Institute website. There's actually a very good self-assessment that people can do that can actually sort of index the level of depression that people might have. It's quite anonymous. It actually allows them to print a report for themselves, and they can take that to the GP. And there's also a clinic at the Black Dog, both face-to-face and also remote, that they can attend to actually get good help.
Yeah, so I guess that's the important thing, isn't it, Richard? The family members, you're not responsible for trying to fix that person, but just making sure that they've got access to good support, and so that they can seek the help that they might need. We've got a question from the audience. We've seen many traumatic events in the past couple of years, like the bushfires, COVID, and the floods. And the question is, and this might be maybe for Justine to start with, at a population level, what can we do to enhance the resilience of the community so we can avoid the potential adverse mental health impacts of these traumatic events? And then maybe we'll go back to you, Richard, as well. But first of all, Justine, what can we do on a community level?
I think, well, to begin with, it's just about messaging, the importance of your well-being and mental health overall, and to be supportive of each other during these kind of events. I know that Richard has done a lot of work directly with these kind of scenarios, so probably Richard, you have a better.
Yeah, so Richard, we'll go to you. Yes, we'll ask you as well. So what can we do? And I know you're working, for example, in helping people like in Ukraine, and how do you help people in that example, and how do we become more resilient to deal with these? Because these sort of events that we've been dealing with are not going to go away. How do we become more resilient as a society so we can better cope with these types of events?
Let me be a little provocative and say, it always annoys me a bit to say that we're going to make the community more resilient. It's a great buzzword, to be honest, amongst politicians and agencies to do this. And
because it puts it back on the individual. Is that why
well, it's partly that, and we see it a lot, to be honest. And I mean, Kate might have an opinion about this, where very often a lot of organisations want to sort of help their workers become more resilient. And we see this a lot in the military and in first responders, etc. But it's not that simple. It's like we all want to sort of be able to cope as well as we can given difficult, situations. And we know when there's cumulative trauma, and we've seen that a lot in certain parts of Australia lately, where we had the bushfires, followed by COVID, followed by floods, economic downturn. It was like one wave after another. And so a lot of people have just been worn down, and we will expect that to have an effect. We need to be able to help people get through that. It's about realizing that resilience or coping occurs in a big, broader context. So we have to help the individual, we have to help the workplace, we have to help the other infrastructures and community infrastructures that are in place. And to be honest, our knowledge, our evidence about this is actually very, very limited at the moment. Lots of programs are being implemented willy-nilly, but we actually need much greater evidence. And we are starting to do that. We've done some very cool work after the Black Saturday fires, for example, where we actually did something called social network analysis, where we actually looked at like over 1,000 people in the affected communities and mapped all their mental health, but also mapped how they all interacted with each other. And we could actually look at how community structure impacted on mental health, and how even mental health was even contagious across people and across communities. And we need to develop paradigms to be able to study this, because that's then going to inform policy and practice. But we're only just at the beginning of really knowing how to do that.
Fascinating. That research sounds amazing, and I'm sure we would love to hear more about that as it goes. We hear, as that research continues. And maybe Kate, Richard mentioned the sort of the buzzword of resilience and trying to make workforces more resilient. But is that something that in your view needs to happen to improve workplace mental health, or what would you like to see happen? What would your message to the audience be in terms of boosting workplace mental health?
Look, I was nodding furiously in agreement with Richard there, and in terms of that broader conversation around the community, and I think the same applies in a workplace context. I think it's simpler to kind of bring out some training, and yes, it's effective and it works, and it does actually make people feel that their well-being is boosted, etc. But it's not the only component that is important. That we operate in a system, and the system we operate and the workplace we operate is part of a community. So I do think that systems level stuff that Richard's raising is really important. So yes, I do think psychoeducation and those types of programs of building capability and building, to Justine's point, psychoeducation, so people understand what is in their control, what should they do more of to help to keep themselves as well as they can. But our workplace does have broader responsibilities than that. They do need to consider the psychosocial risks attached to their working environment, and they need to understand those in a comprehensive way, to put in more system-related interventions to address those risks. And those things take time, so they're not as quick acting as a training program per se, but they're really, really important in the broader, more meaningful iteration and evolution about workplace mental health. And so role design, team design,
workloads, looking at people's workloads and things like that.
Absolutely.
Could I just add one thing, which I think both Richard and Kate nicely highlighted, that resilience is a buzzword, but really we should remember what it is actually defined as. So it's just the process of positive adaptation following adversity. That's what it is. And so it involves quite a lot of things in that process. So it's not just about having the grit or the tenacity to just work your way through something.
Just to sort of grin and bear it.
Yeah, it's a whole lot of factors. So it does come down to a little bit your genetics, your environment, a bit of your personality, a bit of coping mechanisms, but there's also a whole lot of things external to the person. So their resources that they actually can rely on. So the community support, if it's financial, medical, spiritual support, whatever it is, but they all need to actually be involved in that whole process.
Oh, look, thank you so much, Justine. And look, we're going to have to wrap up our discussion because the time's absolutely flown by. So I just wanted to thank Justine, thank Richard, and thank Kate for their time today. And I also just wanted to remind the audience, if they are not already following NeuRA on Instagram, to follow them. It's NeuRA Australia, follow them on Instagram. And now there will be a follow-up email that's coming out tomorrow. and it's going to include a lot of the links and any websites and details of Justine's app and Richard's clinic, and also Kate and the Corporate Mental Health Alliance. So anything that we've discussed today that you might want to follow up, they'll be in that follow-up email. So keep an eye out for that, as well as the link, and you can then share that with everyone, with your friends and family. And so again, Richard and Justine and Kate, thank you so much for your time and your wisdom. It's been fantastic. It's been a great discussion, and I think the audience has really got a lot out of it. And it's certainly been, it's just fascinating, the insight that you've brought to this sort of complicated issue. But we've all learnt a lot. So thank you so much. And yeah, it's been an absolute pleasure having you for this discussion. And I'm sure if the audience wants to get in touch, they'll follow up with in the follow-up email. But yes, thank you so much for your time, and keep up all the great work in all your different areas, because I think we've all been through quite a bit in the last couple of years, and we certainly need the great work that all three of you are doing in your respective areas. So thank you so much. It's been amazing.
Thank you.
See you later.
Bye.
Thank you.
Bye now.